Hello, everyone. This is Louisa Moats. I am a board member of the Women's Foundation and also was chair of the task force that developed these recommendations for our focus grant for 2022. This session is to help you understand in more depth why we chose the areas we did and what we meant by our selection of each of the three possible areas for a focus grant in 2022. I led a wonderful task force. Trinka Dyer, Laura Midgley, Susan Passavoy, Kit Wright, Lillian Wu, and I worked for several months as a team to develop these recommendations. We were convened by our president and our grants co-chairs following the board meeting in September of 2020, at which we, the board, voted to award a larger grant of $100,000 in the grant cycle of 2021 to 2022. This larger grant should be renewed for a second year pending review of the first year's implementation. Our task was to research, discuss, and identify three possible focus areas for the larger grant to be approved by the board and voted on by the membership. At this point, the board has approved our recommendations, and it will be up to you, the voting members, to select our priority for a focus grant in 2022. So a word about our process. We chose as a group to emphasize this question in our inquiry: what does our community need? We then brainstormed areas to investigate and identify key individuals in the community who seemed very close to the issues and who were cognizant of the role of philanthropy in addressing those issues. The task force conferred about every 2 weeks between September and January of 2021 to process and respond to what we were learning. This is a list of most of the people we interviewed during our inquiry process, and you can see they included many key members of the community who are either working with a nonprofit or who know very well the landscape of needs in our community. As we decided on our selection process, we were guided by some principles which we can articulate here. Number one, as I said before, we wanted to let the community tell us what was needed here. We aimed to have a substantial, systemic, and longer-lasting impact on the focus area than we have been able to do with a series of very helpful but smaller grants that we've awarded over the past 15 years. We wanted to prioritize prevention of adverse life experiences and marginalization, those circumstances in life that lead someone or a family to fall over the cliff of need, as was expressed to us by a presentation from the Community Health Center in our winter forum a year ago. We wanted to strive to address inequity, reduce opportunity gaps, and promote participation of diverse and marginalized groups in the life of the community. We also viewed this larger grant as an opportunity to lead in the community, to educate others in the area of focus, and hopefully to attract other funding to resolving longstanding problems in that area of focus. And we were guided by the idea that the grant applicants will know best what needs to be done and how to do it. And so we were informed by our sessions from Philanos on trust-based philanthropy. We also, in our inquiry, had to confirm that there is capacity in Blaine County, in our valley, within the nonprofit community to handle a larger grant. So as we formed up what the priority areas would be, we knew that there would be nonprofit entities who were capable of implementing a larger grant. And finally, as we were exploring the issues, we had to recognize that this is an innovation on our part, on the part of our grant funding practices, and we can't predict everything that might happen. So we have to go into this with our eyes wide open, but recognizing that we may have to learn from the experience and we may encounter issues we didn't anticipate, but that would not prevent us from taking this step forward as an organization. So as we selected our priority issues, we also determined that we would not select some others, and those included housing, which is obviously a chronic and serious problem in our valley, but we determined that was too big of an issue to take on in the Women's Foundation. Senior care was another possibility, but we thought that was relatively well funded at this time. Support for the arts is a crying need, but we ultimately deemed that it was not the highest priority at this time. Environmental action around climate change, for example, or food or water land preservation. These are major issues that we all need to be involved in solving, but there are many other organizations that are very active in this area, and we also had just given a $75,000 collaborative grant on waste management in this area. We also questioned whether or not we should focus primarily on the needs of girls and women, and decided by virtue of what we were told from all those we interviewed that it didn't make a lot of sense to prioritize girls and women, because all people of all genders were in need of support and innovation in the areas that we did select. So there is an overriding theme, and these three priority areas that we've selected for your vote could be classified as falling under one umbrella, and we might describe that as addressing chronic inequities in our community through prevention, early intervention, and innovative problem solving. So our recommended areas are the following, and I must emphasize that these are in no particular order. So in my talk here, I am not conveying that we think that there is a 1, 2, or 3, but merely we want to distinguish these three areas and put them up for your vote. So the first one is bolstering mental health assistance and addiction prevention programs. So why is this important? Why did we deem this important? Well, statistically, we know that suicide attempts, and rates of drug and alcohol abuse are on the list of the most pressing health needs in our valley. And this is according to the St. Luke's Community Health Needs Survey. And these were identified even before the pandemic over the last year, and they've been greatly exacerbated by the pandemic. Coupled with that, those grim statistics are the fact that there is no longer a drug coalition, that there is no coordinated attempt to address addiction and related mental health issues in the Valley. And nationally, we know statistically that only about 20% of the people who experience addiction even seek treatment. And I'm sure that the situation is no different here in the Valley. So there are many other social, emotional, psychological consequences for untreated problems in these areas that include job loss, and stresses that affect family relationships, and that contribute to the problems of social isolation that we've experienced over the past year. So what would we want to do by funding a grant in this area? We would strive to reduce the need for crisis intervention services, increase availability, access to, and integration of psychological, emotional, social, and health-related supports for individuals and families, and increase participation in positive resilience-building activities designed to improve social, emotional, and mental health and ability to manage stress. So a lot of different kinds of grant-funded activities and initiatives could come under this area, and I've listed some here. They would include support groups, training peer counselors, establishing a drug coalition, once again, promoting physical and mental health in various ways, preventing adverse childhood experiences by providing integrated services to families, something we were told is sorely needed, and promoting the community resilience model, which has already taken hold here in the Valley across a number of different entities that serve health, care, education, and emergency services. So a second area of focus for a large grant would be closing the equity gap in education. And why is this important? Well, statistically, it is very clear that our Hispanic or Latinx population, which is 43% of the enrollees in our public school system, and which is a growing proportion of our population, experiences significantly lower academic achievement, beginning with kindergarten entry and starting well before kindergarten entry. This population, as well as others, drops out of school more often, attends college at much lower rates, experiences additional challenges just keeping up with the requirements of schooling. Some of these are related to the gap in technology services that are experienced by under-resourced families. And COVID, of course, has exacerbated all of these differences. And as one principal told us, many students have basically lost a year of schooling because of COVID and the challenges of remote technology-driven learning. So what will we hope to achieve with grant funding in this area? We would strive to reduce the achievement gaps between subgroups of students beginning as early as possible, improve attendance, graduation rates, college and career access for minority students, and all students at risk for poor outcomes. We provide instruction and support to all students who have experienced COVID learning loss. So what kinds of activities might occur in this area? Well, there are many, many. The landscape is wide open here, beginning with funding preschool opportunities, academic tutorial support services, college counseling, life coaching for completing school and defining future goals, training volunteer tutors, mentoring high school students who might be interested in becoming teachers, supporting adult literacy so parents can support their children at home, teaching parents how to advocate for their rights, addressing the digital divide with technology resources, connecting the community with libraries and their services during the summer and the school year, supporting apprenticeships for students needing familiarity with the world of work, holding institutes for early childhood providers and others to build awareness of evidence-based teaching practices, and so on. So the third area is perhaps a little less tangible, but nevertheless very important. And we've called it building an inclusive, equitable community. So why is this important? Well, as we know, our valley has long been divided by economic, cultural, and racial disparities. We have subgroups in our valley that have little contact with others. Individuals from one part of our community have been underrepresented in leadership and are invisible in the majority's community life. Although this social, cultural, and economic divide is long-standing, the jobs, housing, family life, and health of marginalized groups have suffered disproportionately in the pandemic. The inefficiencies of a segmented service system inhibit the effectiveness of nonprofits and limit the benefits of services provided by a community that cares, but that isn't addressing the underlying causes of inequity. So what would the possible goals of grant making in this area be? We would want to increase participation of all members of our community in decision-making and leadership roles in governance, education, economic forums, community organizations, and family support services. We want to empower individuals to advocate for themselves. We want to build Hispanic or Latinx leadership capacity and support systems in schools, economic forums, civic organizations, and neighborhoods. We want to increase cross-cultural engagement and celebration, inclusiveness for all abilities, and sharing and understanding across these separated subgroups. So what do we envision could happen with grant making in this area? Well, these activities might include funding personnel who will work actively to include underrepresented groups in the economic, cultural, social, and recreational aspects of life in our community. We could support celebrations and exhibitions of cultural traditions. The grant might develop opportunities for children and youth from different subgroups to recreate and interact to promote understanding, acceptance, and mutual support. We could create more internships and apprenticeships for young people, develop youth leadership and public speaking skills, develop ways to encourage and fund broad participation in outdoor recreation, which has been described as the great equalizer in our valley. So you are the key to the next steps. It's critical that a wide proportion of our membership takes the time to vote. The ballot will go out the first week of March, and it will have two parts. It will include this year's finalists for this year's pooled grant funds, which you will vote on, as usual, in rank order of your preference. It will also include a section for you to vote on your preferences for the focus grant that will be awarded in 2022. That also will be a rank order vote. So please give this due consideration. Join our discussion groups, if you will, that are set up over the next month if you want to ask questions or discuss how to sort out your priorities with other members of the organization. Thank you so much for your involvement and support.